Hi everyone, welcome back to my channel. If you're new on this channel, kindly subscribe and click on the notification bell so you can be notified when I upload a new video. In today's topic, I'll be talking about acid-base balance and how to analyze arterial blood gas results, and I will be going through the respiratory and the metabolic balance. But before I proceed, I'll make us to understand some terms and some values before I proceed to the explanation. And we need to understand that the acid and the base in the body must be maintained so to prevent acidosis or alkalosis. And there is a way the body helps to maintain that by balancing the pH and the CO2, and also balancing the bicarbonate in the body. So there are three systems that the body uses to maintain the acid-base balance in the body. We have the chemical buffer system, we have the kidney, and the lungs. How the chemical buffer system works is by combining H2O with water, that's HCO2, to give us bicarbonate. So it combines the CO2 and H2O together, and it releases bicarbonate out of the system. And why the kidney, it helps to produce HCO3 out of the system, why the respiratory basically deals with the CO2. We'll be looking at the respiratory and the metabolic. When you hear the word respiratory, it tells you lungs. It tells you about you need to understand that this deals with the CO2. And when you hear about the metabolic, you need to understand that it deals with the kidney, that's HCO3. So, and the simple terms we need to know is that the acidosis deals with the pH of the body, and the alkalosis also deals with the pH of the body. We need to understand that when the pH is less than 7.35, we have the acid, and when the pH is greater than 7.45, we have the base, that's the alkalosis. So we'll be looking at respiratory acidosis. Respiratory, lungs, that's the CO2. Acidosis, pH, that means the pH is reduced. So in this case, the pH is reduced and the CO2 is increased. What are the causes of respiratory acidosis? We have asthma, atelectasis, we have bronchitis, pulmonary edema, we have pneumonia, we have emphysema, we have hypoventilation. That means a patient with respiratory acidosis will hypoventilate. That means it's retaining CO2 in the body. What are the interventions? Monitor the patient for respiratory distress. You administer O2 to the patient. You place the patient in a semi-fetile position, and you monitor the patient's electrolyte level. And there is a way the body tries to compensate this by releasing hydrogen ion into the system. So the value for this one is that the pH will be reduced and the CO2 will increase. And we'll be looking at the respiratory alkalosis. Alkalosis, respiratory means the lungs, that's the CO2, while alkalosis, the pH, that has the increased pH greater than 7.45. And what are the causes of respiratory alkalosis? We have fever, we have hyperventilation. That means the patient is removing excess CO2 that is on the body, is hyperventilating. And we have hypoxia, we have hysteria, we have pain, overventilation. And overventilation in this case is for patients who is on mechanical ventilation and is taking too much oxygen into the body. The patient can have respiratory alkalosis. And what are the interventions as a nurse? You monitor for signs and symptoms of respiratory distress. You assist the client in the breathing technique, and also you monitor the client's electrolyte level. And there is a way the body tries to compensate this by excreting CO2 out of the body. This leads us to metabolic acidosis. So the cause of metabolic acidosis, we have diabetes mellitus, we have DKA, we have excessive injection of aspirin, we have malnutrition, severe diarrhea, renal insufficiency. Intervention: you monitor clients for respiratory distress, you monitor the intake and output of the client, monitor the potassium level of this client, and there's the way the body tries to compensate this is through Cushman breathing. And you discover that the pH will be low in this case, and the HCO3 will be low in this case. For metabolic alkalosis, the causes include diuretics, excessive vomiting or suctioning, injection of excess sodium bicarbonate, massive transfusion of blood, and burns. What are the intervention as a nurse? You monitor for respiratory distress, you monitor potassium level, you replace the client's potassium, and you treat the underlying cause of this disease condition. So, and in these clients, you discover that the pH will be increased and the HCO3 will be increased. The summary of all this is that there is an acronym to understand the respiratory and metabolic acidosis and alkalosis. We use ROME. ROME as in respiratory, and the O is opposite. That means respiratory does the opposite of the pH, while M, which stands for the metabolic, E stands for equal. That means metabolic does the equal of the pH. So ROME, you remember that respiratory, as the pH increases, the CO2 decreases. As the pH decrease, the CO2 increase. But in metabolic, as the pH decrease, the bicarbonate also decrease. Why? As in the pH, in metabolic alkalosis, as the pH increase, so the bicarbonate also increase. Body system, these rely on the pH before it can maintain a balance. Peculiarity about it is that it causes hypoventilation, while respiratory alkalosis causes hyperventilation. Metabolic acidosis, it deals with everything in the body, while metabolic alkalosis is specifically for patients who has vomiting. If you feel this is useful, kindly subscribe to my channel, and I will see you in my next video. Thank you.